Okay, so once you feel absolutely fine with all the movements in stage one, that might be a couple of days, it might be a week. Okay, you just need to determine when you feel comfortable enough to move on to the next bit. For this next stage, you're going to need a foam roller or a rolled up cushion and a chair to sit on. So the first movement we're going to do, we're going to now start introducing a shifting movement through the hips. So far we've got our hips tilting back and forth. We've got the hips moving within the pelvis. Now we want to get the pelvis shifting from side to side. This is particularly useful. Like I said, my left side locks up more than my right, so that gets really stiff. So I want to reintroduce some lateral movement through the hips themselves. So you're going to need a wall. You're going to lie on the floor, feet up on the wall at 90 degrees. So 90-degree angle from the floor there, and heel and knee at the same angle. 3 points of contact. Big toe knuckle, little toe knuckle and heel. They stay in contact with the floor throughout the whole movement. Before I do anything, I'm going to ever so slightly pull my feet down the wall and tuck my butt under slightly, so the small of your lower back is just off the floor. And you should feel your hamstrings, backs of your legs engage. I'm going to take the foam roller and I'm going to squeeze it, not too hard, okay, just so it doesn't fall. Again, cushion under your head if you need to. What I'm trying to do here is I'm trying to pull my left knee down, and what will happen as I pull my left knee down is my right knee will raise up. I'm not trying to push my right knee high. I'm just focusing on pulling my left knee down whilst applying a little bit of pressure to the roller, whilst pushing your feet into the wall and dragging them down. So there's a lot going on here. So I'm just going to pull my left hip down. So you should see my right knee looks like it's moving up. Then I'm going to pull my right knee down. You probably see a bit more movement there because my left side is the tight one. And again, I'm going to match my breathing. I'm going to inhale on one, and I'm going to exhale on the other. So. Don't force this to start with. You might not get any movement, or it appears like you don't get any movement at all. You might not see your knees move whatsoever. It's the intent of trying to loosen that up a little bit. So again, I'm pressing my feet into the wall. I'm trying to pull them down the wall slightly, which pulls my butt off the floor, and I keep that pressure. Pull down. Pull down. Pull down, pull down. So this is all about the pull down with a combination of a little squeeze. So you should be able to feel hamstrings, hips move, knees move. So we're getting the pelvis now to loosen up and shift from side to side. Okay, so for this one you need a chair to sit on. Dining chair, edge of the sofa, doesn't really matter. But I want you to sit right on the edge of it. What we're doing here now is we're introducing flexion of the spine and letting our body weight pull us down and over. So I'll do it from the side so you can see the movement. Everything relaxed. Start off with by just dropping your head, slumping your shoulders. And to start with, that might be enough. You shouldn't have any pain with this, anything sharp. You're just trying to convince your nervous system to allow yourself to round your spine. So again, you're going to use breathing for this. I'm going to breathe in here. Then as I exhale, I'm going to let everything drop. I'm going to hold that position while I breathe in again. And I'm trying to fill up as much of this as I can. Then as I exhale, I'm going to go a little further. Hold as I breathe in. Fill up my upper back. Exhale, go a bit further. I'm letting everything stay completely relaxed. Okay, so you'll do your breaths until you get to a stage where you think, this is as far as I feel I can go. Don't force it. There's no tension. You're not trying to force yourself down. Nothing's tight. You're just letting gravity do its job. And again, talking to your nervous system through the breathing to allow you to go a little bit further each time. Any sharp pain, anything like that, stop. You've gone too far. Let the breathing dictate how far down you go. Okay, so ideally, cushion for this one for your knees. Now we're going to start introducing hinging at the hip with your body weight kind of following in the opposite direction. So the idea for this is we're going into hip flexion, not spinal flexion. We've done that with the rounding. Now we want the spine to stay neutral. I just want to send my hips back, which means by proxy, my shoulders will come forwards. I'm not trying to move my head and shoulders forwards. It will happen because I move my hips back. So the idea is I'm moving my pelvis back so that my hips rotate in my pelvis. And then when I come back up, I'm imagining I'm trying to squeeze my glutes, squeeze at the top, so I'll now open up the front of my hips. So this is what this is called, is hip flexion, then hip extension, which is when my pelvis locks up. They're the two movements that it just does not like doing. So I need to reintroduce it through this process. When we do these glute squeezes, on the first one, you're only going to squeeze your left glute. On the next one, you're only going to squeeze your right glute. And on the third one, you're going to squeeze both. Because my left side is much tighter than my right. If I always squeeze both, I'm probably going to squeeze my right a bit harder because it'll take over. So I need to purposely squeeze my left to teach that side to open up at the front of the hip. Breathing again, exhale on the way down. So inhale on the way down, exhale at the top. So you can put your hands on your hips like that. You can put them on your front to almost guide your hips back. It's worth videoing yourself doing this just to see what happens to the spine. You want no movement from the spine at all. You don't want to start it with your chest, and at the bottom you don't want to arch. You only want to move from the hip joint. I like to imagine I'm a foosball table. I've got a rod going in one hip and out the other, and I'm only allowed to rotate on that rod. So I'm going to send my hips back as I inhale. Then as I exhale, I'm only going to squeeze my left glute. And I'm squeezing quite hard at the top. And what that will feel like, it'll feel like you're turning slightly to the right. Fine. Then I'm going to go back. This time I'm only going to squeeze the right glute. Squeeze quite hard. Back again. Now I'm going to squeeze through both. This is really important to learn to move through the hip, not the spine, particularly at the bottom and top position here. Because what we tend to see, or what I tend to see, is when someone sits back, they'll arch their lower back because it gives them the illusion of going further. And when they get to the top, they'll tuck under, round their upper back because it gives it the illusion that the hips are going further forwards. You only want to feel here. Front of the hip on the squeeze, back of the hip on the stretch. This might take some practice, and that's fine. The longer it takes you to get it, the longer it'll stick. You can put your hands on your pelvis if you want to feel the movement. Pushing my pelvis back. Exhale and squeeze the left. Squeeze hard. Send back. Squeeze right. Send back. Squeeze both. Don't be shy to squeeze hard there. But like anything, any pinching, if you feel it in your back, in your lower back, that's probably telling you that there's movement through your lower back. It's not bad to move through your back, which is why we're doing some of those exercises, but we want you to be able to move purely from the hip. That'll help everything there chill and allow more movement to happen. Okay, so now we're looking at a movement that's going to open up the side, because with my lower back, like I've mentioned at the minute, left side gets locked up. This side doesn't want to crunch down. It feels really stiff and tight. So I want to try and get my hips moving laterally, side to side, to open and close this area here. We're just doing this with a very simple step to the side, with a reach, but there's kind of a couple of things we want to focus on. So I'm going to step out to the right, bend this leg. I want this knee to go forwards, not outwards. As my knee goes forwards, I'm trying to push this hip that way, which will push this hip that way. Then I'm going to lean to the opposite side and reach over. So I'm going to open up my ribs, my obliques, kind of side of the lateral hip there. So gently to start with. Exhale as you reach as well. So I'm going to breathe in, step out. So I'm actively pushing this hip over, and I can feel a bit of a stiffness in this glute here, but this is going to give us a nice closing here, opening here. I'm not trying to force, I'm not trying to reach as far as I can. I'm just timing that push of my hip with a slight reach on the other side to open everything up. Once I've done the set amount of reps on one side, same on the other side, you'll notice probably straight away how much less movement I have on this side. And like I said, we want that knee to go forwards, not outwards. We don't want our whole leg to go out. We just want our hips to shift whilst our knee goes forwards. With that reach, then that's opening everything up on each side.